Hello everyone and welcome to another quick tips video. Today we're going to cover the Midas event entry process. Um, I highlight Ilorine Talenti's information here at the beginning of this program, and you will see her information at the end. Please consider her as a valuable resource in the Midas event entry process. Our first step in the Midas event entry process for reporting is to go to the St. Mary Links page and select Midas event reporting. Future State, our Trinity applications page, and our ZenWorks page will have appropriate icons for Midas event entry. At present, the Midas event management icon is the only one available, but stay tuned for an icon for event entry as well. So when you're selecting an appropriate header for your event entry, please do so carefully. Choose the header that most appropriately pertains to the event you're trying to describe. These events are event reporting is helpful to everyone in the facility to avoid near misses, to protect our patients from harm, and to protect ourselves as well as our visitors. For the purposes of this demonstration, we're going to select a medication event related event. The first field you should utilize the facility code capital M, capital L, and capital P. When you select MLP and then hit the tab button, St. Mary Medical Center will populate immediately. If you choose to select this ellipsis on the side, you will be forced to paw through multiple different fields of facilities associated with Trinity. So your best bet is to simply type in the letters MLP and hit tab on your keyboard. That allows you to select St. Mary Medical Center immediately. Please choose the appropriate date. For the purposes of this demonstration, I will be choosing a non-patient event to remain HIPAA compliant, and we're going to select next. Within this data entry field, as these fields do vary from event type to event type, I urge you to consider the bold headers as far as information entry. These headers are what is essential to the event report. The other data is helpful, but because of the need for you to cycle through this process as quick as possible, we urge you to just pay attention to the bolded headers. When you're notifying a provider, please do select that you did. Hopefully you have notified them and have written a physician notification documentation in Meditech. If it's not appropriate to notify a provider, say you're describing a non-patient related event, please do notify your supervisor or manager. So saying yes in these headers may vary depending on the type of event you're reporting. You do not necessarily have to find the name of the person because you will see again when you're selecting this ellipsis there are hundreds and hundreds of names that you will have to cycle through. So the most important is the bolded headers in these fields as well. When you're describing the story, please be as clear and concise as possible in this field. You do have an eventual character limit, but it is most helpful for the people gleaning the information from this report to have a brief but clear description of what exactly happened during the event. And then please do also type in your name. If you choose not to type in your name and you want to enter this data anonymously, that is possible for you, and you can certainly type in the word anonymous in this field. Once your event is complete, you would click submit. Unit managers have access to these report in the event management portion of Midas, so your follow-up for these incidents would be most appropriate with them. A few key points to keep in mind. Please educate yourselves about patient safety concepts, especially those that are most specific to the unit that you are working. And also, we encourage you to report near misses so that other colleagues can benefit from your information. Please also keep those lines of communication open between you and other members of the frontline healthcare team. Lorene Talenti is available at this number as well as in her office across from the medical staff office. Thank you for your attention and for everything you do for our patients.